Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. I'm going to show you how to compare Medicare drug plans to find the best Part D plan for you. I'm going to show you how simple it is to use the Medicare website to find a comparison chart and find the best plan based on your medications. So the Medicare Plan Finder, of course, is at medicare.gov. That's what we're going to use. I'm going to show you how quickly it is to find the best plan for you using this useful tool. We want to be certain that the plan will cover your medications. If you're on chronic medications, you want to go ahead and put those into the Medicare website. They're going to help find a plan that will cover them for you. And you want to consider all the costs. You want to consider not just the monthly premium, but you want to think about the deductible as well as copays or your costs at the pharmacy, coverage gap once you reach the donut hole, how much it will cost, and then other considerations to consider. If you're low income, things like that, you may be eligible for lower copays. So for this example, we're going to go to medicare.gov. You can also contact Medicare by calling them at 1-800-MEDICARE, which is 1-800-633-4227. In this quick example, I'm going to show you with the medications atorvastatin, lisinopril, and Symbicort. Okay, so here we are at medicare.gov, medicare.gov. To use the plan finder, we're going to click on Find Health and Drug Plans. From there, we can put in our zip code, click Find Plans. If you'd like, you can actually create an account and so you can access it at other times without having to go through all this. Medicare coverage, if you don't have coverage yet, you can click that you don't, that you're shopping, or you don't know. Then it's if you get extra help, if you're low income or get supplemental income, you can click there. I'm going to click I don't get any extra help. And would you like to add drugs? Yes. For the most meaningful information, you're going to want to add the prescriptions that you take. Okay, so for this example, I'm going to use 3 drugs: atorvastatin for cholesterol. We'll just pick the 20 milligrams, number 31 every day. We're going to add the ACE inhibitor lisinopril. For blood pressure, we'll do the 20 milligrams once a day, number 30, and then we'll put the inhaler Symbicort, 160, one of those, one per month, one inhaler per month. Okay, so here are our 3 drugs. Once we have all the drugs added, we can click My Drug List is Complete. At this point, you can pick your pharmacy that you want. We'll just pretend this is our pharmacy and continue to plan results. Okay, so we're going to want to, for this example, we're going to look at the prescription drug plans. Again, there are other options there to look at. And here's a listing. 27 plans were found. Listing by the lowest out-of-pocket cost. So this one has a monthly premium of $24.50 and a deductible of $100. That's pretty decent. This one has a monthly premium of $51.60 with no deductible. Here we have $21.30 with a deductible of $355. All right, so let's just, to compare these, to get a comparison chart, let's pick this one with this really low monthly premium at only $10.40, but it has a deductible of $415. And then we'll pick this one that has no deductible, but your monthly premium is going to be higher. So we can tick those 2 boxes and then click on Compare Plans. And here it will bring up a comparison chart. Here's our 2 different plans, SilverScript Plus, WellCare ValueScript. Monthly premium, deductible, and it's going to show estimate of what you will pay at the pharmacy that you picked. So this one with no deductible is a little cheaper, and it breaks it down by cost. This one with a $415 deductible, we're going to get nailed that first month, of course, for the $400 almost, because we have to meet that deductible. Where the other one is a little more budget friendly. Your monthly premium is going to be higher, but you're going to have a more predictable cost when you're at the pharmacy. It's going to cost about the same each month. You will reach the donut hole in November, it looks like, so then the cost would go up a little bit, but still, for most folks, it just the SilverScript in this instance would be a little easier on the budget because your cost is predictable. You don't have to cough up almost 400 bucks in January, but you know, then after that, your costs are expected to be about $50. So that's something to consider. That's the nice thing about Medicare.gov is that it breaks these down for you. It shows you the different cost comparisons. You can also look at the star ratings. That's just how current customers rate the plan, and it's just really handy overview of the Medicare plans. Be sure to put in your medications, and it will tailor the plan to you. Any Okay, so other considerations when you're looking on the Medicare website and putting in your medications, remember generics save money. The more generics you can be on, if you and your doctor determine that there are generic medications that will work for your conditions, you can save a lot of money over the course of a year. As many conditions can improve with dietary and lifestyle changes. Some of the big ones, diabetes, type 2 diabetes, can see dramatic improvement. I've seen people get off brand name medications when they start exercising, lose a little bit of weight. That's a conversation you have to have with your doctor though. But if you think about it, that could save you a lot of money, and you know, you could live longer too and just feel better. Nebulizer medications are another consideration. Like in this example, there was that inhaler, Symbicort. Oftentimes, if you have a chronic breathing disease, you can have nebulizer medications filled with Medicare Part B, B as in boy, that's separate from Part D, the drug plan. And many times it's at a significantly lower price. So it just depends on the condition. If it's a chronic condition, it's not as convenient to use nebulizer medication, but if you're on a super tight budget, it just could make things a little easier for you. Thanks for watching. Go ahead and ask any questions in the comments below. I'll do my best to answer them. And if you like videos like these, I'd love it if you'd subscribe to my channel. Thank you.